to it once that happens, and we will also be airing it online at ktvb.com and on our KTVB app. As we wait for the governor to speak, right now we are about halfway through phase 2 of the governor's 4-phase plan to reopen Idaho. In this phase, your favorite restaurants have been able to open back up and you can get your hair cut. Nail salons and gyms have also been able to reopen, but with each reopening, businesses need to follow social distancing and cleaning guidelines. Phase 3 is scheduled to start next Saturday, May 30th. Gatherings of 10 to 50 people will be allowed. Non-essential travel to places without ongoing transmission can resume, and the 2-week quarantine will be lifted for people entering Idaho. In last week's news conference, the governor said bars can also open in phase 3 of his plan. They were originally scheduled to reopen in phase 4. Previously, the governor has added that any of these phases can be delayed if there's a significant spike in new cases. The state reported 28 new cases yesterday for a total of 2,534. That's probable and confirmed cases combined. A probable case means that a person hasn't been tested, but they are showing symptoms and they've come into contact with someone that has tested positive. 77 people have died in Idaho. More than 1,700 people have recovered from the illness. Since Sunday, we've been averaging about 24 new cases every day. In this graph, the number of new daily cases is indicated by the light blue bar, and the dotted line shows the average number of new daily cases over the last 2 weeks. You can see a slight decrease in new cases over the last few days. In a telephone town hall earlier this week, Governor Little shared where the coronavirus is taking a significant toll. At the time of the town hall, there were 75 deaths linked to COVID-19, and he said that of the 75, 42 happened at long-term care facilities. Right now, we are going to throw it over to Governor Little's news conference, which is starting right now.
Thank you for joining us here today. This press conference is about testing and related COVID-19 issues. The task force, and you'll be hearing from them, was chaired by Dr. Souza from St. Luke's, Dr. Ball from our state lab, and of course Director Jepson, and you'll hear from Elke here in just a moment. But it was a little less than a month ago I announced the creation of the new public-private task force to create a COVID-19 testing strategy for the state of Idaho moving forward. The testing task force has been hard at work for the past month to develop the new strategy. It's co-chaired by Dr. Jim Souza, the Chief Medical Officer from St. Luke's, and Dr. Chris Ball, who you'll hear from in a moment, the Director of our Bureau of Laboratories. I'm truly honored and grateful that all of these incredible professionals, and you can see the list in the handout, have put forth so much of their time and expertise to assist their fellow citizens. We have a strong team of very capable local clinical, laboratory, and research experts from across the state helping us navigate this crisis, and I sincerely appreciate their help. A strong economic rebound can only occur with a combination of efforts, and expanded targeting and testing as a big part of our strategy. Testing capacity is starting to significantly expand in Idaho and elsewhere. The testing task force is helping to set expanded criteria for who should be tested and when to be tested. The task force is helping us move toward a common reporting platform for testing capacity and utilization across the state. The group's work will help inform the Idaho Department of Health and Welfare, my coronavirus working group, chaired by Director Jepson, healthcare and laboratory entities, and businesses on statewide testing for COVID-19. The task force completed its recommendations, which will serve to inform the most effective reopening actions. I'm going to let Elke Shaw-Tulek, the Administrator of the Division of Public Health, expand on the group's work. So, Elke.
Glasses. Thank you very much, Governor. Appreciate the opportunity, and we're very excited to be here today to discuss the release of Idaho's testing strategy for COVID-19. As you are aware, an important part of Idaho's and the nation's ability to reopen our economy is the ability to test for the virus. quickly intercept spread through contact tracing, robust community mitigation, as well as personal responsibility. These measures need to be taken to slow the spread of the disease until we have adequate population immunity and/or a vaccine. And as the governor has pointed out repeatedly in his press events, these measures need to be taken to keep our healthcare system from being overwhelmed and keep our curve below the line that he references. Oftentimes in my division, we discuss COVID-19 and its spread in comparison to a wildfire, something that Idahoans know well. We think of the virus as a spark that can be triggered by man-made or natural causes that we want to quickly put out by tossing a blanket on it. The spark is the virus, and the blanket is our epidemiological investigations and contact tracing. The fire can have an increased chance of exploding into a wildfire with every spark that is unsuccessfully extinguished or gets flamed into an area that does not have sufficient fire breaks. In the case of COVID-19, that flaming of the fire can be caused by people not practicing their social distancing, proper hygiene and disinfection, and not self-isolating when they are sick. The insufficient fire breaks are the lack of a vaccine or population immunity. Testing in this analogy represents the fire spotter searching for the sparks that start the fire. To make this be successful, we need many, many fire spotters or tests operating in a coordinated way. To create the path to move testing forward in Idaho, the department convened a testing task force made up of members from several hospitals, pharmacy, private testing groups, local health, and representation from across the state. The task force met over the last several weeks and produced a strategy for statewide testing. It lays out the what that needs to be done to identify all of those sparks. The how it will be accomplished or operationalized will be developed over the coming weeks. We'd like to thank the task force for all of the work that they've put into this plan. We do have existing capacity within the state. Our state public health lab has the capacity to run approximately 200 tests a day. For high priority testing, we have worked with the VA to set up their high throughput lab to run tests for non-VA patients. And we are working with them to help with with corrections facilities as well as long-term care facilities. And we also have a large hospital system in the Boise area who's ramped up their volume of tests. We have also received 15 point-of-care tests through FEMA called Abbott ID Now that we've deployed across the state, and they're currently located in every public health district across the state. In addition to the Idaho labs, there are commercial labs outside of the state which the samples are sent to. However, this has not been without the challenges, as many of you have heard, because testing supplies have been difficult to get, but testing supplies have definitely improved over time. Recently, the federal government announced a goal to test 2% of the population each month. To achieve this goal, they sent Idaho 40,000 swabs and viral transport media for the month of May, and we'll be expecting the exact same amount for the month of June. This will help, but more testing needs to be in order to ensure that we have the people, the testing instruments, and supplies to test all of Idahoans needed to be tested. Before I turn this over to Dr. Ball to provide you with more detail on the testing strategy, I want to reinforce that testing is not a standalone solution or strategy to address COVID-19. I mentioned that there are many strategies that must be deployed to prevent COVID-19, the wildfire spread, if you will, in that analogy of COVID-19, but I would like to address the importance of contact tracing in the mix because it does three important things for us. It identifies that person who has the disease and helps us identify that person and who they may be in contact with. That's through our epidemiological evaluation of that case. It also helps us identify who those contacts might be and then follow those contacts. And lastly, it helps us then monitor the whole slew of people that are involved with that one case and who are contacts of that case. In Idaho, this is very important because we want to make sure, well, it's important across the nation as well and everywhere, but to make sure that as we identify those cases and the context of those cases, it's again like putting that blanket on that spark and preventing that from spreading. In Idaho, we do use software, or we may use software as well to manage and organize that monitoring piece because as you can imagine with every case, there are several contacts, so we need to be able to manage that effectively. However, we are not using software that utilizes things like Bluetooth and a tracking device. We know that that's been a concern and that we've had comments about that, but I wanted to make sure that that's clear. Most contact tracing in Idaho can be as simple as a phone call. So testing and contact tracing are important elements in preventing the spread, but physical distancing, personal hygiene, and personal responsibility are paramount. So with that, I would like to turn it over to Dr. Ball, and he will give you more details about the testing strategy.
Thank you, Elke, Governor, and members of the Coronavirus Working Group for providing me the opportunity to speak on behalf of my co-chair, Dr. Souza, and all the members of the testing task force. The testing demands of COVID-19 are unprecedented. In February, our state public health laboratory was the first in the state to provide coronavirus testing, and since then, public health, healthcare, and laboratory communities have gone through an incredible transformation. I am honored to work with the task force members to describe the current coronavirus testing status, to project what future testing needs may be, and to recommend strategies for how we can provide testing while building additional capacity so that all Idahoans that need testing can get it. Our first task was to determine how much testing is currently being done in all regions of the state, and how much more could be done by quickly scaling up. What we found was this. We estimated that our testing capacity in early May was approximately 7,500 tests per week. Further, we projected that if our supply chains continue to improve, and we don't encounter any new or unexpected barriers, that our maximum capacity could be almost 23,000 tests per week. These estimates include both work performed in Idaho laboratories and from out-of-state commercial reference laboratories. If we are to meet the federally established goal of testing 2% of the Idaho population every month from now until the end of the year, we will need to test around 8,000 Idahoans per week. This will require that we both expand local testing capacity and continue to utilize out-of-state reference labs. We also found that Idaho clinical laboratory testing capacity varies regionally, and the lack of local testing capability is primarily a function of a lack of access to testing materials. This situation is slowly improving, but increasing access to those needed supplies continues to be a challenge. The testing task force strongly recommends that investment in local testing capacity be significantly increased. This will allow Idaho to continue its safe reopening and help us maintain the state's economy. We also recommend expansion of molecular diagnostic testing now, which in combination with proven public health practices like tracing, physical distancing, enhanced sanitation efforts, hand hygiene, and instructing ill people to stay at home to protect others will help us stop the spread of COVID-19. Molecular diagnostic tests identify the presence of the virus. This tells us who is currently infected. Knowing who has the virus is the most important information we need to reduce disease transmission. We recommend a limited use of serologic or antibody testing. This detects human antibodies that were directed towards the virus. The presence of those antibodies tells us who has been exposed to the virus in the past, but that does not guarantee that they will be protected from reinfection. We do feel that there will be important public health uses for serology testing, but at a later point during the response. Next, we provided recommendations for how testing across all groups of people should be expanded. This will include testing for both symptomatic and some asymptomatic people. We propose 5 testing priority levels based upon testing need. Priority 1 represents people with the highest need for testing, and priority 5 represents those with the lowest need. An example of a priority 1 is any symptomatic healthcare worker. For this group, testing that provides a same-day result is ideal. We estimate the need for this group could be up to 1,200 tests per week. Samples would mostly be collected at healthcare facilities and, if possible, performed in a high-throughput laboratory here locally. Other examples of Priority 1 groups are residents in nursing homes, both those that are ill and those who don't show symptoms. We are working quickly to increase testing ability for this vulnerable population, and in total, we estimate that all the priority group people, both those people with and without symptoms, could require approximately 17,000 tests per week. An example of a Priority 2 population is asymptomatic individuals and staff in a correctional facility, where early detection is critical to prevention of facility outbreaks. Adding in all Priority 2 group individuals could require an additional 26,000 tests per week. A Group 3 priority population could be an asymptomatic employee at an essential business that has high volume of public-facing work, for example, a large retail grocer. This could add an additional 86,000 tests per week. The takeaway message from these recommendations is that we will need to build incredible testing capacity, plus the ability to respond to all of those results with appropriate clinical and public health follow-up care. If we hope to provide this wide-scale, repeated testing for all Idahoans who may need testing, it will be a very collaborative effort. As both capacity and testing to follow up on those results grows, we recommend starting with the individuals with the highest priority needs, so those in groups 1 and 2, and then expand those to lower priority groups, groups 3 through 5, as quickly as possible. If all priority groups were being tested weekly, we could be looking at least 150,000 tests per week. So in conclusion, the task force thinks that, one, as Elke recommended, testing for coronavirus is not a strategy that stands alone. It informs public health prevention strategies and our state's mitigation efforts. Well-executed risk mitigation efforts will achieve both the reductions in disease transmission that we're looking for while we're successfully reopening and maintaining our economy. And lastly, we feel that a robust approach to educating the public, businesses, industry, school, and others must be a critical part of our enhanced prevention strategies so that we can effectively mitigate the transmission risk for this disease. Thank you.
Questions? Betsy?
As of yesterday, the Kaiser Family Foundation's ranking of per capita testing by state showed Idaho in last place, 51st out of the 50 states and the District of Columbia. I understand that we didn't used to be in last place, and I wondered, why have we fallen so far, and what does this mean with our strategy for ramping it up so much?
I'll make a shot at it, and then Elke. We were aware of that, but some of the states are counting lots of antibody, lots of serological tests. Our testing in Idaho, for the most part, is quite rigorous. And there are multiple entities that are analyzing that metrics that you alluded to. Most of the metrics that Director Jepson and I talk about, we're about in the middle. And I don't know, Elke, do you want to add to that? I didn't mess it up, did I?
Thank you, Governor. You did a great job. I think I would add to that question, or the answer to that question, that a lot of the testing in Idaho is also demand-driven. And fortunately for us, we've seen a decrease in the demand, which means we're seeing less people that are ill. So part of our challenge, of course, is going to be that as we see that demand drop and the illness rates drop, we also at the same time are wanting to ramp up so we do have more robust testing. And we have been testing just those folks in Idaho to date that are symptomatic. So as we start increasing, as Dr. Ball was talking about, our priority groups and testing asymptomatic people, we will see definitely an increase in the amount of testing that will be done.
So as Have we not been counting serological testing, antibody testing in our totals when other states have?
To repeat the question, I don't know if everybody could hear that. We have not been counting results from serological testing in Idaho to date.
And as Elke alluded to, we're it depends upon what the top decile or the lowest decile of the number of incidents, which is part of the reason that it is demand driven. So, Don?
Governor, in the analogy that Elke put forth, she talked about a fire.
I love that.
She talked about putting a blanket on the fire. It occurs to me that the testing is seeing the fires there, but the blanket is contact tracing and some of that. What's being done on that side of the fence?
You're a good student. As we looked at this report, I have to scale. It's not me. They're doing all the hard work. We have to scale tracing with testing because just no one going out there and saying there's 100 fires doesn't do you any good if you don't have a hand crew to go out there and put a line around them. So that is the scaling of the tracing, and I think we're going to have, how many tracers are in the queue? We're ramping up to nearly 500. So you're exactly correct. The nexus between testing and tracing is it has to be scalable.
What's the interaction with Crush the Curve here?
Actually, we've got two examples recently because if you read the report, and I highly recommend you do, it's riveting reading, no offense, doctors, but it talks about just like what recently took place in Washington County in Weiser, that public-private partnerships are a big part of what we're doing as far as having that capacity, because we've got this strategy, these 5 different layers. Well, we've always got to keep a little capacity in case you have a fire. I'm going to steal that from you, Elke. In case you have a fire somewhere, so I have to have some capacity in both tracers and testing to go into those areas where you have a spot fire where you didn't think you would. So that's part of what Crush the Curve is. We're looking for other partners to do that all over the state, because one of the lines in the report is we've got some testing deserts. We've got some areas where they don't, which is just the very nature of the state of Idaho, areas where they don't have big hospital systems like St. Luke's that are close, or Salzer and Crush the Curve.
A question from Nicole at the Statesman. How will the state handle testing at large food processing facilities or other agribusinesses? Will employers continue to foot the bill if they want to test their employees?
Well, I believe that in the fry foods, everybody got tested, and of course, you know, any employer has some obligation to maintain the health of their people, and it depends upon whether they're covered by insurance also. Some employers that provide package, those insurers in Idaho are already paying for the testing. So I think the answer to Nicole's question is it depends. But our intent, and I'll let Dr. Ball talk about the rest of it, is our intent is that when we have these spot fires, which could be one of these facilities where people, just because of the design, are in close proximity to each other, you can have a lot of spread soon. But if there's a specific in the report that you want to talk about, go ahead, Doctor.
Thank you, Governor Little. This is a very challenging question to answer, primarily because there are multiple parties that need to be involved. So not only are we worried about trying to get tests completed, but we also need to make sure that we're getting accurate contact information for employees, we're providing adequate follow-up care, and we also have to have big teams of folks that can mobilize to actually collect and process those samples and get them to the laboratory. So I know that this pandemic response has been very focused on testing capacity, and testing numbers. But as we've said, testing is just one part of an integrated response. And so we've been delighted to work with some of these community partners like Crush the Curve. and to work with them to try to address some of these employer needs. And Nicole is absolutely right. These are challenging questions to answer, and there's not one single way that we can do that.
Dr. Ball, while you're up there, how many tests can the state labs handle in a day, and how often have they been hitting the maximum daily limit? That's from Jacob at the Statesman.
The state lab currently, we can process about 200 tests per day, as Elke mentioned in her remarks. And our demand has been fluctuating recently. Early on in the response, we were hitting close to that number on a very regular basis. But as local laboratories have brought on additional testing capability, the demand for the state lab's work has gone down. And so we've shifted our focus to move primarily from testing ill hospitalized patients and potential ill health workers to focus more on some other very vulnerable populations. Most recently, we're working very in concert with public health districts around the state to test people in long-term care facilities.
Does the state have any plans to make antibody testing widely available, also from Jacob at the Statesman?
At this point, we're unclear about the best uses for antibody testing, as I mentioned in my remarks. Antibody testing is helpful in determining who has had the infection in the past. So there is some value to be gained in knowing whether or not you may still be susceptible to this virus. And early antibody results would suggest that the vast majority of people who presumed they had the disease did not mount an antibody response against it. And so more people may be vulnerable to disease than they actually think. And so it's very important for them to follow along with all of the public health mitigation efforts that we've discussed.
From Audrey at the Statesman, what actions will the state take to ensure adequate contact tracing for positive cases?
I think that this is probably a question that's better answered by my public health colleagues. I'm more of a laboratory specifics person, so I'll turn this question over to Elke.
May I ask a quick follow-up with Dr. Ball? The vast majority of people that have the disease do not have the antibody response. Those who were lab confirmed positive?
So, Betsy, that's again a nuanced question. So when I reference that information, I'm referencing information that was based on an effort by the Crush the Curve campaign to provide antibody testing for folks in the Treasure Valley. And over a period of time, they tested over 4,000 people and used a very reliable antibody detection method through the University of Washington Clinical Laboratory. And based on those over 4,000 results, only about 1.8% of those people were actually positive for antibodies. So it's very difficult for me to extrapolate based on that convenient sampling as to what that may look like in a broader statewide environment. And also, we don't know how many of those people that got antibody testing were also tested using molecular diagnostic methods. So it's not really easy for us to draw direct comparisons there. So to get back to the contact tracing question, Elke.
And to make sure I'm remembering the question correctly, it's about our plan for contact tracing, correct?
Yes, Audrey asks, what actions will the state take to ensure adequate contact tracing for positive cases?
Great, thank you. So it's a really important piece of the puzzle. As we keep reiterating, it's only one of the many pieces that we need to assure. But right now, we have multiple things that are underway. We've been convening a work group of folks to create a contact tracing strategy similar to the testing strategy that lays out that roadmap, if you will, for how we increase the volume of people who have the capacity to do contact tracing. If you recall, I mentioned there are 3 elements of contact tracing. So first, you have to have that sphere of the epidemiologists who are really investigating the disease. They're working with that person who is diagnosed. Then that next sphere out are those people who are contacting those people who are in close contact with the confirmed case. And then that outer sphere is the monitoring of all of those individuals to monitor for people who become ill or who may come into contact with other people. So it's quite a large investment, and it's heavily the investment is heavily in people. It's a people resource, making those phone calls to people, having conversations with them to understand where they've been, all of that. So the plan moving forward is to really increase that capacity because this work is done at the local level. We are supporting the local public health districts in their training of additional staff to be able to do the contact tracing or that conversation, if you will, with the people who are in contact with the confirmed case. I know that they've applied for additional funding and to be able to increase their staffing levels. We've developed a kind of an in-house training, if you will, and then there's also national training platforms where you can train non-clinical staff to be able to do that work. We have trained a cadre of people at the State Department or Division of Public Health, so we can deploy those folks to also be able to do that. And we're looking at lots of different ways that we can just ramp up the number of people who have this testing, or excuse me, this training to be able to do that. So we're kind of creating this big fleet, if you will, of people who are behind the scenes ready to go as testing increases. We will see more cases because we will find more people. So that will be really important then, as I said, to quickly sort of throw the blanket on each and every one of those sparks and be able to manage all of that kind of wildfire management, if you will.
And a question from Rachel at Boise State Public Radio. What are Idaho's biggest challenges to increasing testing to the level the task force thinks is necessary?
So there are a number of challenges that we face if we're going to try to increase capacity to encompass all 5 groups that we have identified in this testing task force. The primary challenge that we're facing right now is regular and steady access to testing materials. As I mentioned in my opening remarks, the testing demand for this pandemic response is unprecedented, and manufacturers of scientific equipment have done everything they possibly can to try to increase their manufacturing capacity. But that being said, the demand for those products has far outstripped the ability to distribute those to places where it's in need, including Idaho. So what we really need to do to expand testing capacity is use a very measured approach that looks at risk factors and who needs to be tested first. And what we're also seeing is that there are technology improvements that are happening almost daily and new testing devices that are being approved for use through the FDA's emergency use authorization process on a weekly basis. And many of these new rapid point-of-care diagnostics that will be coming available over the course of the summer should really help us improve both the speed and number of tests that we can provide. So there are many challenges that face getting to those levels, and we have to be patient, and we also have to be willing to build that capacity in proportion to our ability to respond to the increased testing frequency.
Another question from Rachel. Can you talk about how Idaho plans to increase testing in rural parts of the state?
As the governor mentioned, there are some real testing deserts in Idaho, and that's largely due to the rural and frontier nature of our state. There are many areas where there just aren't many people, and there isn't a lot of local health care available. So as Elke mentioned, we've been working to try to expand local testing capacity by distribution of assets that we received from FEMA, and working with allocation of materials that we're also receiving from the federal government to these rural sites. And as I mentioned in my previous response, as new testing materials become available that are applicable for rapid use in a point-of-care setting, these are the types of devices that we need to get into these areas so that we can address local needs in these rural populations.
And a question from Michael at the Statesman, this might be for the governor. What happens if and when Idaho moves out of all 4 stages? What sort of guidelines and requirements will be in place then heading into the fall, and will we be fully back to, quote, normal?
And I would love normal this fall. I want to start answering that question by a lot of the questions. This high-quality professional testing task force is not going to go away. There are all these new ways of testing, methods of testing that we're using that we find there's a deficiency here or a deficiency there. So this is going to be a dynamic process. If we get a big rain, you know, a great treatment or a vaccine, I don't think there's any way a vaccine is going to be ready by this fall. Matter of fact, I'm quite certain of that. But you know, the whole goal of this is to scale up testing with tracing to where we can do what Idaho likes to do in a good fire season, and that's get on those fires early and put them out and do all the management processes like these and hand washing. I don't have any sanitary up here for a prop, but if we do all of those things, we're basically doing the things to minimize the danger of that fire, and that's our goal. But we are not. I don't think there's any measurement that we're going to have normal by this fall. It's going to be a new normal with a lot of the practices that we talk about all the time, but we're going to have to continue to take this testing report that's coming out today and continue to update it, look at new testing methods, whether it be the less invasive swab, whether it be a saliva test, whether it be any of the other testing, and continue to update that, because the simpler it gets, and what's really critical is the PCR test that most people are aware of consumes an enormous amount of PPE. And so if we can go to a testing that doesn't use that critical amount of PPE, that'll help in those testing deserts that are written about in the report. Everybody understood the report perfectly. Betsy.
What made you decide to have this press conference today in person for the first time since you stopped?
I miss seeing you guys.
Big holiday weekend. People are excited to go out and be out in the world and do the things that they'd like to do in years past. What's your message to the people of Idaho as they gear up for this weekend? There's temptations to go out there and live like it's normal, but as we know, it's not.
Well, one of my fellow governors, and I've been quoted stealing his quote, is minimize transmissible moments. Minimize those opportunities. Obviously, if it's your loved ones, if your family you've already been with, you know, there are no barriers. But if you're going to go to an area and be in higher population areas, just be cognizant of the risk of minimizing those transmissible moments. We want in every way, shape, or form for the economy to be open back up, but we know we have these limitations. And of course, one of the limitations is consumer confidence. We see it here in Boise, we see it in other communities. Even with the restaurants able to be open, they can't be open because people, there's not the demand there. So the better we all do collectively, the better we preserve the sacrifices that everybody's made. You know, schools being closed, stay at home, a different, totally different behavior than we did 80 days ago. We're going to preserve those sacrifices and be able to progress into as normal a fall as we possibly can. But this start of summer is a critical thing. But I will tell you, and it was actually something that in one of our very first coronavirus working groups, is that, and now it's being adopted more and more, is that UV light, being outside, your risk is way lower than it is being inside. So as you go, as the people of Idaho go out to enjoy the holiday weekend, if they come to a fork in the road, if they can do it outside, there's a lot less risk. I'm glad you came.
Governor, I heard recently that you had changed the point at which state parks would reopen in the process of your reopening plan. What's going on with state parks? Will they open for the holiday weekend or not, and why?
Well, I think all the parks are open. The question is the campgrounds and the status in the campgrounds. I think they had a Parks Board meeting yesterday or day before, and if they change policy, I've been a little busy, I didn't see it, but I think all the parks are open. The question is some of the campgrounds, and Elke, do you know? Director Jepson knows.
Thank you, Governor. Thank you, Betsy. The state parks at this point, unless something's changed in the last couple of days, are not planning to open camping until the end of the month. Many of the Forest Service and Bureau of Land Management campgrounds are planning to be open. You need to call ahead. Some of them are still closed due to weather conditions. Some of them are still snowed in, the normal things that happen this time of year. And not all of them are open as part of their plan. So some are open, some are not. And the best thing to do is, if you're doing that, is to call ahead. And then I would just emphasize the message that you've heard many times today in this press conference, which is outside is good, but it doesn't mean we should stop using the practices that we have to try to minimize those transmissible moments.
Okay, well, thank you all very much. I've missed you. I'm glad to see you all. You're all healthy and you're all wearing your masks.
We just saw Governor Little's press conference about increased testing and a task force that has been put together to help get that done. We will have more later on in our newscasts and also at our news at 4 and 6. Governor Little's next scheduled press conference will be next Thursday, May 28th at 1:30. The governor's office says the governor will address phase 3 of Idaho's 4-phase reopening plan. Idaho is scheduled to enter phase 3 next weekend. You can watch that full press conference right here on Idaho's News Channel 7. That again is next Thursday at 1:30. The News at Noon continues after this.
But first on Idaho Today. Food insecurity is a year-round issue, and it's greater now than ever before, so one local business is stepping up to help. Rob, tell us about the donation that Team Subaru Nampa did for the Idaho Food Bank.
You bet. We were lucky enough to be involved in 50 million meals being donated by Subaru Corporation, and we were involved in that process. And then locally, that for us made 40,000 meals being donated by Team Subaru and Subaru Corporation.
Wow, so you've been able to supply 40,000 meals to the community